Hello, my name is Dr. Seidu. I'm head of research for Primary Care Diabetes Europe. And today we are attending the ADA conference in San Francisco, and we've just had the detailed results of the Carolina study. The study was unsurprisingly neutral since we had the headline results a few months before. And my take on the study is that it has not changed my practice very much. Prior to the study, what we tended to do in real clinical practice was mindful of the fact that sulfonylureas cause increased risk of hypoglycemia. We avoided using sulfonylureas in patients who are at very high risk of hypoglycemia, for example, patients who are elderly and frail. The results today have confirmed that in terms of cardiovascular events, there is no difference at all between linagliptin and glimepiride. And it is very reassuring because there have been some suggestions by some authors in various journals that sulfonylureas have a higher risk of cardiovascular event compared to other oral glycemic agents. This study has actually resolved that confusion. The downside of the study against sulfonylureas, however, is the confirmed increased risk of hypoglycemia in the sulfonylurea arm, 38% compared to 11% in the linagliptin arm. Which again is unsurprising. We've always known this, and it is a reason why we've always avoided using sulfonylureas in elderly frail patients. And so the finding today does not change our practice. It is worth noting, however, that the sulfonylurea used in this trial was glimepiride, and there are sulfonylureas and sulfonylureas. Glimepiride and glycoside to some extent are the safer options. The other longer-acting sulfonylureas have been shown to cause more hypoglycemia. It is possible that if any of those was compared to linagliptin, we would have seen some worse cardiovascular events against sulfonylureas. So from the study point of view, I think the take-home message will be that glimepiride is a safe drug and can be used comfortably, especially in the setting of situations where we have cost as an issue. The main reason why people tend to prescribe sulfonylureas as opposed to other medications is because they are cheap. And if you look at the numbers needed to harm from the Carolina study today, if you actually choose your patients very well, given that the average age in this population was a little over 60 years of age, if you choose your patients very well, younger, fitter patients, you could actually safely use these drugs without incurring significant cost due to admissions for hypoglycemia. Thank you very much.